Hello and welcome. It's 11 a.m. here in Seoul. I'm Ji-young at the Arirang News Center. We're breaking into our regular programming to bring you the latest live briefing from the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Yoon Tae-ho, the overall officer of disinfection at the Central Disaster Management Headquarters, will be briefing us on the coronavirus situation here in the country. The briefing will give us an update on the number of new infections as of midnight, as well as any trends and the latest on the vaccine rollout. Also, the latest social distancing measures and efforts that the government is making to contain the virus. To give you a brief idea as we wait, South Korea reported 545 new cases of COVID-19 on Wednesday, up 172 from yesterday's figure. The briefing is about to start, so take a listen.
Let us now begin our regular briefing for today. First of all, today at our quarantine meeting, we have discussed the pilot run of the social distancing scheme. Currently in Gyeongsang-namdo and Gyeongsang-bukdo, and also in parts of Gangwon-do province and all of Jeollanam-do province, where we have low number of cases. Relatively, we are running a pilot run of our changed social distancing scheme, and most of these regions have a low population congestion rate, and we also have a very low infection rate there as well. And we have put in place some regional specific guidelines as well. And as for these pilot run programs, we are seeing that they are being rolled out in a stable manner. And as for Gyeongsang-bukdo province, which was the first to adopt such a system, for the past week, they have seen the daily average. The average of the infections per 100,000 was staying at 0.15, and this has also been relatively stable, staying at 0.06. And also in Jeollanam-do province as well, we have seen that the situations were also similar. They changed from 0.3 to 0.34 per every 100,000 people after the implementation of such system. And in Gyeongsang-namdo province, we are also pulling out and putting in forth the flexible operation of these social distancing schemes. And we are also seeing an ease in the gathering ban of private gatherings, and we are also seeing a revitalization of the regional economy. And also in these regions, we have seen the average consumption increase by 8%. And in Gyeongsang-namdo province, we have carried out a survey for 2,000 people, and about 90% of the residents have said and answered that they have positive opinions about such an implementation of the pilot run program. And we believe that these guidelines, if they are also added on top of these streamlined guidelines as well as these regional guidelines, we believe that we will not have bigger challenges in containing the virus going forward. And even if small outbreaks continue to break out at regional places, we will have the flexible operation of the antivirus measures. And based on these measures, we will also enable our social distancing scheme, and these will be based on a sense of responsibility and authority and autonomy, that is for the local governments. And as for the details, we will be disclosing the details as of Sunday. And as of today, midnight, we have 522 new local infections and 23 new imported cases. And we also had one more fatality. I extend my deepest condolences to the deceased and the members of the bereaved families. And yesterday alone, we have administered the vaccine to about 617,000 people, and this is about the first dose recipient. And currently, our 25.7% of the total population, or about 13,219,000 people, have received their first dose. And we have also tightened and also speed up our target initiative initial target of 13 million by 2 weeks, and we were able to achieve this in advance. And we believe that we are able to achieve our further goal, and we are also continuing to ask you to continue to have credibility in the government's target and our guidelines. And this was all possible thanks to the participation put forth by the members of the public, as well as the many efforts put forth by the public servants and also medical professionals. And currently, South Korea has the most up-to-date and sophisticated infrastructure, as well as a medical system. And thanks to these infrastructure, we are able to contain the virus to a large extent. And even at this moment, as we speak, there are many people who are fighting on the forefront to roll out the vaccinations. And we also want to thank our citizens for participating in the inoculation drive. Moreover, during the past year or so, there have been many people who have been working on the front lines, especially those people who are working at the local community medical health community centers, and we want to thank you once again. And due to a prolonged COVID-19 outbreak, in order to decrease the amount of work burden on you, we are exerting our full efforts to mobilize more people and more personnel to these local community centers. And in March, we have also mobilized more people, allocated more budget so that we are able to mobilize 1,000 more people for these local community centers. And also going forward, we will make sure that we can increase the number of staff members who are working at these facilities. And once again, we would like to mention all of the people who are working at the forefront of the K-quarantine, including the public servants who are working at these local community health centers. We want to thank you once again. Currently, our medical response capacity is at a very sufficient level, and as for the ICU hospitals, we have about 73 hospitals that are available for immediate use right now, and also for the hospital beds for the mild and the moderate symptom patients, we also have about 64% of the hospital units that are available for immediate use. And there are 0 patients who are awaiting to be administered to hospitals. However, we are continuing to see about 500 cases on a daily basis, and currently we believe that our inoculation rate is still short of the reaching a herd immunity right now, and also gradually prohibiting the further infections of these COVID-19 virus. However, for the past year, we have learned how we can tackle the COVID-19. This is all about reducing physical contact. And so as much as possible, we ask you to utilize and make use of outdoor spaces. And if you are going indoors, please wear your face mask at all times, except when you are consuming food. And the government will also make sure that we can return to a state of normalcy as soon as possible. Thank you very much.
That was the government briefing on the COVID-19 situation here in the country. South Korea reported 545 new COVID-19 cases on Wednesday. This brings the accumulated number of cases to 149,191. There has been one more death, raising the death toll to 1,993. We'll wrap up the coverage here, and we'll be back at 12 p.m. Korea time for midday news with Mark Broom. Bye for now.